Thank you. Welcome again to everybody. We started with the first edition of the Bangalore Debates in October last year, and the purpose is really to expand, enhance, and enrich the civic space that is available in Bangalore and hopefully eventually in other cities as well for meaningful and deep conversations. And the idea really through these conversations is to build greater degrees of trust between citizens and civil society and policy makers so we can really strengthen democratic governance and accountability in India's cities. And an important part of this is really to pick up issues that we believe haven't received due attention in policy discourse in India and to have deeper in-person conversations rather than holding on to polarized views online. So thank you so much for being an active part of this. And the other key feature in the Bangalore debates also is to ensure that, this is not a typical format where the audience only listens, but to set aside enough time for conversations. So just to open the conversation, Mr. Gundarao, we rarely hear about public health as an important concern in Bangalore. And that itself should be a major concern for all of us. It almost appears, if you're tuned into the public discourse in Bangalore, that the only challenges impacting Bangalore are potholes, traffic, waste, and during those season, flooding. And it almost appears as if public health is not a problem. And I was actually quite rudely awakened looking at the National Family Health Survey of 2019-21, the fifth cycle, to see that actually many of Bangalore's outcome indicators are actually below the Indian urban average and also below the average of other Karnataka districts. Because as you know, Mr. Gundarao, Karnataka is one of the pioneers in setting up urban health systems, particularly the primary health level. But it appears that Bangalore's growth has in some ways overshadowed our concern for health. So thank you for joining us, Dr. Ashwath. We just got started a few minutes ago. Mr. Gundarao will be with us online. So Dr. Ashwath, if I can get started with you, you also happen to be an MBBS, am I right? So it's a stellar panel that we have with us here today. So I'm going to get started with Dr. Ashwath Narayan and then get a couple of reactions from Mr. Gundarao before opening it up. So Dr. Ashwath, what I started saying was there appears to be a conflict between growth and well-being in Bangalore, where over the last 20 years, Bangalore has emerged as among the world's fastest growing cities. It has attracted incredible amounts of investments and capital and talent. But somewhere along the way, all the conversations today about Bangalore's even infrastructure remain restricted to potholes and roads, traffic and waste. But a very important determinant of well-being, public health, is often under-discussed. So I want to open up this sharp question to you of, does Bangalore offer a healthy life to us as citizens? Do you see the possibility that Bangalore in its current trajectory of growth and development is likely to ignore that and not look at public health as an important outcome? So it'll be good if you can also answer with a sharp yes or no.
Yeah, definitely yes, because the growth, the trajectory or the good growth can definitely give us a lot of strength. And we need to prioritize because Bengaluru is a very important city for our country and as well as for the entire world. Keeping this in mind, because we have the best of the talents in the city of Bengaluru, we need to address the most important issue. The health is very important, probably because many other issues, because we have been always, the attention has been taken over by many a times by a pothole. See, there are many other things where it is visible issues they have taken over, even with regard to the waste management. Small things, these small things and traffic congestions, this has taken that priority. Along with this, we need to take it up very strongly because ultimately the longevity, the good health is a very important factor to make it a very productive economy. We need to prioritize probably in this direction. We need to create a lot of awareness, and the economy also gives us a lot of strength because when it becomes a very important city, we need to address. Otherwise, if we don't address, we'll be letting down and we can't see a good future. We need to have a good future. the good promise or the good growth or a very potential area, when what is very potential, what is economically very rewarding, we need to take care. So for the good of the state and for the good of the country, we need to address. Yes, I think the growth also is a very good factor. Where there's no growth, we don't,
But will the current trajectory of development of Bangalore, do you see that as a risk to general public health?
I don't think so. Unless a city doesn't grow, the economics, you know very well, the growth is a very important yardstick. If there is no growth, it shows that it's a, I should not use this word, a dying city.
Thanks, Dr. Ashwath. Over to you, Mr. Gundarao. So really, this could be the reason we named it the Bangalore Debates is to depart from the usual consensual panel discussions where everybody says the right things and to try and be a little more provocative and arrive at conclusions. But this could be one of those areas where, we are having bipartisan consensus. So Dr. Ashwath has just said that he doesn't see a major public health risk. But given that you have the vantage point of the entire state, how do you really see public health as an important outcome area that Bangalore should work on? Because you are not just the Minister for Health and Family Welfare, Government of Karnataka, because you're probably also among the longest serving MLAs of the city. You've been serving as an MLA for 25 years now. So your perspective on this?
See, first of all, I don't think Dr. Ashwath said that public health is not we're not at risk in terms of public health, but he said that growth cannot be compromised. Growth will happen, but I think public health attention that Bangalore needs, I think due to this rapid growth, I think public health has not been able to grow commensurately, which it requires for this huge city. And if you look at the numbers of personnel that we have, whether it is doctors or nurses or ASHA workers to the population, it is far less compared to rest of Karnataka. And especially in the rural areas, definitely it's much below that. So there is a gap there. And the other thing that is we are facing, and I've been having discussions, is that public health is there are so many issues which come into public health. One is the quality of life, the quality of how are we addressing when we are developing the city. Are we addressing the issues concerning health in terms of mobility, in terms of pollution? Those things also become important, and that I think now we need to focus more on that. When we talk about development, it's not just about building flyovers and roads and developing new layouts and new infrastructure, all that. Along with that, I think the factor of how do we ensure that the city doesn't become what some other cities have already become in India, where pollution is a scare and literally some cities are becoming unlivable. So we shouldn't go down that path. So that kind of discussion should happen at all junctures. And the other thing that I find that we are facing a challenge in Bengaluru is because the health system in Bengaluru is maintained by the now the GBA, earlier the BBMP. So there is a gap in terms of how the implementation happens. For BBMP, the same focus on doing health programs in terms of preventive or curative, those things doesn't come into that much of a focus. Whereas in the rest of Karnataka, since the health department itself focuses on this, so there we are able to track things better. So I think I'm discussing with the Bangalore administration, BBMP. We need to have a clear, demarcation of what health department is going to do and what the city corporation is going to do. And it's still in the process of discussion, but I'll decide. I am very keen on taking over the public health system of Bengaluru in terms of all our PHCs, Namma clinics, all those things, because then we can, get into the not only just finding out what is happening, but also controlling the administration of that. And we have got the expertise. I'm not saying we are very good, but definitely we can do a better job than the city corporation because that is our core competence. So these are the things that we are looking at, how we can change the health administration system that is being done in Bengaluru. And along with that, when we plan for the city's growth and development, which the growth cannot be stopped and we should not stop it because Bengaluru is growing, but how do we manage the growth with better, results in terms of protecting our environment and being able to see that health of citizens are not compromised. So how do we bring in all those policies into play? So these are the things I think that we are working on, and how do we control the growth of Bangalore in a way which it doesn't become like without any sort of regulation, and uncontrolled growth is also not good. So growth needs to be managed and controlled in a proper way, and that I think is also very important.
Thank you. Thank you for taking the issue head on, Mr.
Yeah.
Gunrao. And it is quite, you've raised an interesting point, but if I can join issue with that on that, our understanding is globally, one of the ways in which cities are managing convergence, including in public health, but on larger issues like climate and gender, is by empowering local governments. So if you are saying that for the right reasons, you're making a push for the health department to take over the public health facilities in Bangalore, don't you think it will worsen the fragmentation in governance and accountability? And the reason I'm asking you this is, Bangalore, we've done a lot of study on governance systems, as you're aware, of different cities. And Bangalore is one of those cities where between water supply and transport and pollution, and various, even health, etc., they are fragmented not just at the city level between the municipality and parastatal agencies, but they're also fragmented at the state level. Public safety and law and order, etc., is handled by a different department and so on. So how will we manage the issue of fragmentation from a citizen perspective? If the health department now takes over this, won't it be better to empower the GBA and for the health department to train the GBA and the 5 municipal corporations?
No, as it is, if you look at it, it is fragmented in the sense that all the major hospitals in Bengaluru is run by either the health department or the medical education department, or whether it's the KC General or the Jayanagar Hospital and CV Raman and Kidwai and Victoria, Boring, all that are purely under the health education department control. And other hospitals also are being built as in city. So some of it we are doing. Some of the hospitals are also built the corporation. So the way where corporations have built hospital functioning, are you able to hear me? So as it is, it's many hospitals in Bengaluru city which are being run by corporation, being run by us, and the staff which is working in corporation. So some of the PHC being run by us, some of it are being run by the corporation. So there's a division there, there's a confusion there. So so this will go. Either we run it fully or they run it fully. I have no problem. We can train them, and even the staffing also. Some of it is our staff, some of it is what they have recruited. So these kind of confusions are there. So that we need to completely remove. Like you said, local bodies should run the local health. I agree with that. But principally, it's fine. But will the corporation bodies give the same amount of focus on health? Like, because for us, that's our full-time job. So these are the things that we need to at least debate. And like you said, as a department, I will say I want to take over. The corporation is saying that yes, we will run all the primary health centers and you take over all the other big hospitals. So whatever it is, it needs to be properly done. And we are in the process of doing it, actually speaking. We are discussing it, and there's a proposal that has been put up by us to them and from them to us. So we are working on that. And hopefully, I think we'll come to some conclusion in the next couple of months. And then I think that should be a better way forward for us.
Mr.
There will be
Gunrao,
more clarity.
Yeah, no, but I think that sounds like an interesting set of actions that are likely to pan out over the next few months. I have one more follow-up question, after which I'll go to Ashwath and then come back to you. So one of the things where subsequently I'll get comments from Srilata as well, is we've seen a exponential increase in migration as well in Bangalore. And there's a general perception of Bangalore as a middle-class city. How are we ensuring that there is adequate attention being given to the urban poor and migrants, given that they have excessive dependence on the public healthcare system? And you yourself mentioned that there's a problem of huge number of staff vacancies, etc. Besides, of course, observations of the CAG report in 2024 that also points out shortages in the number of primary healthcare centers, sub-centers, and so on. So anything's very deliberate and intentional that you think Bangalore should be thinking about with respect to urban poor and migrants?
Yeah. So urban core, like better attention, and like we have launched a scheme called Graha Arogya, which is going throughout Karnataka, except for say Bengaluru city and some city and urban areas like Mysuru and Mangalore, all those kind of corporations, where we are doing a extensive door-to-door survey, and almost we're covering them for 14 parameters where we check for certain deficiencies and how we can address that, whether it's BP, sugar, liver disease, kidney disease, cancers, all those things. So now we want to do it in Bangalore also. So how we can do, and we want to focus on the urban poor for this, especially people living in slums and in where weaker sections are living, to those areas. So we need to use our staff to ensure that our resources to ensure that this urban poor doesn't get left out. And the number clinic concept also is that have clinics in every ward so that people can get access to basic healthcare. And we need to I think ultimately improving our infrastructure and ensuring enough manpower is there. There is a shortage of manpower, and especially for Bengaluru city, the adequate manpower should be filled up. And hopefully, like I said earlier, if we have the full administration, then we will do it. Or if BBMP wants to do it, then they can do it, and we can assist. So we need to get into a proper, streamlining this whole implementation of this, and hopefully that will help. So apart from the treatments are available for poor people in all our hospitals, and anybody who comes with a poor person comes to our hospitals, we give them free treatment. And Ayushman Bharat scheme, Arogya Karnataka scheme is there, and that is available for all the people.
Thanks, Mr. Gundrav. I'll come back to you after taking one short comment from Dr. Ashwath as well. Dr. Ashwath, two questions. One is we spoke about the Greater Bangalore Authority and the how do you manage the fragmentation, which is somewhat pervasive across India's cities, but is particularly acute in Bangalore. You're not new to this. But we read the Greater Bangalore Governance Act quite carefully, and it actually does not factor public health as a very important criteria in that sense. But I know that so your comment on the fragmentation issue and who should be handling it and what should be the relationship between the municipal corporation and the GBA on one hand and the health department on the other would be useful as well. And the second is, I remember that you've been fairly consistent in the attention you've paid to public health in your constituency. I remember seeing several initiatives on opening best-in-class clinics in your constituency as well. So as a public representative who has given a certain weightage to public health, it'll be good if you can throw light on how do you see the city corporation, the local government, paying attention to public health. Like Mr. Gundrao himself mentioned, for them, public health is one other activity.
With my experience with the city governance, the health is not been given the priority. It's been given the least priority. And it needs to be, because basically, if you want to have a healthy society, health is a broad definition, it's a broad issue. It is not just limiting to the curative aspect. See, prevention and healthy lifestyle is very important. We need to work more on prevention. So probably in this direction, the competence with the urban governance with regard to the health is very minimal. And we have many national health programs. The national health programs, many a times when I see in the urban governance, the city governance, it is not been given priority. As Mr. Dinesh Gundarao mentioned, many times we had this discussion whether it should be taken over by the health department or the urban corporation should manage. Seeing my experience, probably city governance, they are not in a position to manage the healthcare as a broader issue, because there are many expertise is required. Much of expertise is required because it's a very broad issue. So we can't deal it in a very limited way, because in the city, always they'll be more interested in the other aspects like roads and basic infrastructure. To provide the basic infrastructure itself, they'll be struggling. So keeping this in mind, even with regard to the required recruitment, procurement of the drugs, even if you go to any of the PHCs, probably at present we have, as per the earlier act, we had 198 wards. We are having only 150 PHCs and 150 Nama clinic, and hardly 2 or 3 CHCs. Hardly 2 or 3 CHCs. And even those PHCs are Nama clinic, we have shortage. There's not even essential drugs available. Investigation is not done, because investigation matters a lot. Because a simple investigation, even a cell count, can prevent a major. It can detect the major issues or the major elements or whatever disease you'll be having.
It
So
appears that you're
probably
in favor of the health department playing a larger
because
role.
since they are not able to deliver. See, it's not that we want to have it, hand it over to the. But as a city, we need to look into all these aspects as a responsibility of an urban governance. Health is the topmost priority, because any city, it has to do economically well. It needs to be very vibrant economy. Health is the topmost priority. Any one infectious disease can destroy the
Economy of the city.
entire
as well.
economy. Many countries we have seen, many cities we have been seeing. So the highest density will be in the city. Anything good will be happening in the good or bad. Anything good also starts with a bigger city. Anything bad also starts with a bigger city. So it is very sensitive issue. Probably in this direction, I feel by whatever experience I've been seeing, even the urban governance, most of the time it is neglected. What happens? Always they're into, they think the city is fine because everything looks beautiful from outside. But if you see from inside, from public sanitation to hygiene, environment, pollution, everything is very disturbing. Very disturbing. Even from waste management, it is very challenging.
I'll come back to you on
So,
this. Yeah. So
keeping this in mind, and with regard to the fragmentation, what you mentioned, sir, there is fragmentation. Ultimately, we need to see how do you benchmark. See, ultimately, we need to benchmark some standards, minimum standards, ask those departments to align. See, at a time, if you ask them everything to be integrated, bring radical reform, you can't expect. The governments should have that will. It is not something which is not possible. It can be done. But only thing we need to prioritize, we need to focus, give the importance, do the necessary things. But probably in this direction, going by my past experience, I don't think so. We can see that kind of positivity. I should not make these kind of statements, but we need to work and bring. At least we need to benchmark, set minimum standards. As the definition of health, physically, mentally, and socially, well-being is very important. Probably all those aspects. Every single factor matters a lot, and we need to work in this direction to. And we need to discuss. See, probably when it comes to the election, also when it comes to the voting, these are not the important issues.
yeah.
These
So
are not been, given the topmost, most
we'll
important.
pick that up in a subsequent round.
Yeah.
How do we make public health a political priority? Now, I know we have very less time left with Mr. Gundrao. So from the audience, Ajay, if I can call on you. So Ajay is the founder and CEO of Swasth Alliance, and he is a medical doctor and he's a master's in public health as well, and he's done extensive work even during COVID in Bangalore. So your quick, brief reactions and also any questions to Mr. Gundrao on his proposal, because it's at one level it's quite encouraging that he's saying that he's taking public health in Bangalore quite seriously, and he has that perspective as a long-serving MLA and as the health minister. But at the same time, if you can also bring in your perspective as a resident of Bangalore and your global experience. So both a comment and a question, Ajay.
Thank you. And it's been very heartening to hear the conversation from our elected leaders. A couple of comments. One is that, we've spoken a lot about curative care, and rightly it was pointed out that there is a whole piece around prevention. As a city, there is also a question around the built environment. Bangalore is a city where the environment actually lets you it could be a great cycling city, for example. Half of us could have come here to this meeting using bike lanes which don't exist. So I guess the question is, from a built environment perspective, given the burden of diseases that we have in the country right now, how is that going to change? The second is that while I understand that there is expertise at the state level, what happens to accountability to the local population from the healthcare system itself?
Thanks, Ajay. So 2 questions, Mr. Gundrao, and I'll add a little bit of context to the first question.
Yeah, I understood what he said. Yeah.
I just want to add
You want to add something to the question?
Yeah. I want to add one thing to the question, Mr. Gundrao. So Bangalore, alongside the huge criticism that Bangalore draws for traffic congestion, is also the fact that Bangalore today has the longest stretch of walkable roads in the middle of the city, thanks in part to Tender Shore. I'm conflicted in saying it because we were involved in that in the conception as well. But the fact is that in the next 2 years, you'll see about 1,000 kilometers of Tender Shore footpaths in the city, is what we hear from the administration. And I've seen that you yourself are promoting placemaking in the Gandhinagar Assembly constituency, converting many of those streets into pedestrian streets, etc. And I was reading that the Vivek Murthy, who's a Kannada origin Surgeon General of the United States, called for walkability as the singular strategy to fight non-communicable diseases in the US. So I'm just adding that bit to Ajay's question. So there's one piece on walkability and cyclability, given that Bangalore enjoys a unique weather. And the second piece really is, if the health department takes over because of the fact that you mentioned that they are the experts. Yeah. How will there be accountability?
Yeah, so addressing the second part first, I think accountability is right now, nobody is accountable. I'm not accountable. Suppose something goes wrong in Bangalore, I will say the GBA has to look into it. And the GBA doesn't have that focus. Dr. Ashwatharan also, from his experience, he is told. Now, accountability will come if I own the whole responsibility. And health department, for us, we will be accountable. We will be probably more accountable because that's what we're looking at on a day-to-day basis. And I think I would say that right now the discussion is going on with the GBA, and hopefully we'll come to a conclusion. But I'll be very happy if I get the entire primary health care into our wings, so that we will be held accountable. And anything goes wrong tomorrow, we'll be answerable. And in GBA, I don't think the system is so huge and vast that it's very difficult to hold anybody accountable for anything. And we know what all happens. Issues gets diverted and people lose focus. Whereas for us, that becomes a focal point. So that won't be an issue. I think whatever apprehensions you and Mr. Ajay have, I think it will be better in terms of accountability, especially. The first part is about bike lanes and
walkability, footpaths.
Walkability. See, this bike lane issue we've been discussing, I think, for many, many decades. And it's been tried in certain places, and unfortunately, for the way our traffic moves, though it's a good solution, I agree. And certain parts of the road in certain areas, maybe we can give some sort of a bike lane. But when there's no continuity to a bike lane, then that itself becomes redundant. And any space which is left unoccupied, especially with our roads and our traffic, where we are fighting for space, I think it becomes very difficult to earmark some separate space for bikes, especially with the kind of road width that we have. Maybe some places you can, but there also, even in the Palace Road, Makery Circle Road, if you go, there's no space available for our cars itself. It's become like that. So it's a good solution, but difficult to implement. But I feel walkability is something that has to be done. It is something that Bengaluru needs. And for that, at the administration, one is ensuring that our footpaths are proper. Second thing is encroachment. Our footpaths, if you make a good, proper footpath, nice footpath, within, say, 6 months, 1 year, it gets encroached. It's happened in my constituency also. It's happened in Ashwatharan's constituency. If you go on our Sampige Road, the entire footpath is only vendors. There's no place to walk. And Tender Shore we did in Gandhinagar. Though to some extent it's far better. So we've been able to manage it. But still, they'll come, they'll put up stalls. So we have to, the administration has to have a proper way of handling it. And, ensure that walkability is something that we need. I think Bengaluru is actually a great walking city if you make it, because of the weather is so good, people can walk, and and if you have the right footpaths, and the right, administer the right management of that, I'm sure we can do it, and we have to address that issue. So I would say, since we're coming to the end of it, I would say that is something that we need to do. And along with what Dr. Ashwatth said, public health is a very important issue. I think even Dr. Ajay said public health is very important, and preventability is more important. So for that, it's our lifestyle, because this is going to explode. We are seeing cancers, kidney failure, heart attacks. This is exploding, and India is going to have a huge problem on this issue. So this is, and no private sector will get into preventability. That only government has to do, along with some good NGOs. But it's primarily the government's job, our job, to ensure that we detect early and we try and prevent onset of diseases. So that is our responsibility, and I think that is what we need to do. For that, it's quality of air, quality of water, quality of the traffic management, even quality of food. Like we've been doing a lot of food testing and all that, especially in urban areas. The food quality also, certain, they're using all kinds of chemicals. So every aspect needs to be addressed. Everything is important, and we need to ensure that people understand the usefulness of having a healthy lifestyle, and that we need to prepare our citizens. And I think that is the biggest challenge that we have.
So would you be open to some structured engagement if some of us get together and engage with you on public health in Bangalore, Mr. Gundarao, particularly on walkability and the last point you made about awareness, etc.? Do you think that's a feasible option for some of us to engage separately with you on that? Would you be open to?
Yeah, we should engage. I think a lot of private initiatives and NGOs and citizen forums, all of us, we need to get together. We need to bring people, but it's not easy. Everybody knows smoking is bad, but people still smoke. Everybody knows, we need to exercise. No, not that we don't know, but I think somewhere Indians, we are so bad at this that we don't want to do any exercise. We are willing to eat at late in the night, 10 o'clock, and go to sleep. We don't even forget that even a simple, half a kilometer walk will do good for us. So we need to instill it, but yes, there has to be a sustained, continuous campaign, because the biggest challenge no more is communicable, non-communicable, and it is exploding. And we need to bring it right into the focus, I think, and all public representatives and all other people, all of us need to get together. I think even at the national level, even the central government, prime minister, all of them get together on this. I think that will be a great thing that we can motivate our people in that direction.
Thank you so much, Mr. Gundarao. Thank you for spending these 40 odd minutes with us. We missed you in person, but really appreciate you making time despite being on travel. Thank you so much. Thank you, Mr. Gundarao.
Thank you very much. Thank you.
So we'll now get into a context setter, which was actually supposed to happen slightly earlier. So the reason we advanced it by half an hour is because of this late change in the minister's schedule. So I'd request Nachiket to spend about 10 minutes setting a context. He's done some excellent research. Over to you, Nachiket.
The minister and Dr. Ashwatth talk about some of the issues that are important for the city and how they are thinking about it. It's a real pleasure for me to be here, and I really want to thank Shrikant and the Janagraha team for inviting me. I'm not a doctor or a policymaker. I'm an economist, and my research is focused mainly on design questions. And of course, as you all know, no question of design is complete without an understanding of urban health, particularly the pace at which urbanization is progressing in the country. What I'm presenting here is a result of a large project that I'm engaged in which what I've tried to do is to look at current health outcomes of hundreds of cities around the world. And fortunately, with these new technologies we have, it is possible to be ambitious about how many cities you look at and what you examine, and go back 100 years for each of those cities and ask the question, what exactly changed about these cities that produced good outcomes or bad outcomes? And the work is at an early stage. It will take several months, as you can imagine. Even with the new tools, it is a fair amount of effort. But I'm taking the liberty of sharing some early learnings with you, in terms of what I'm finding and what the research is actually showing. When we talk about health, and as you saw a little bit in the conversation today as well, we usually think about hospitals, doctors, insurance, but the reality of cities, true everywhere, but cities in particular, is that city is not simply a container of its healthcare system, but the city itself is a living organism shaped by the streets, homes, trees, lakes, where the jobs are, by the pollution, the smell of the air, and the length of the commutes, and the chaos or quietness with which and I'll talk a little bit about why each of these things matters in terms of how we think about the city. And the idea is that health is actually produced by the city, not simply by creating more hospitals and creating more, and in fact, this issue of who should manage the health system in some ways is an important one, but I would submit to you, it is a late stage reaction to a disease that the city created, which maybe an earlier stage discussion could have really helped sort out. And how do you go about doing it? Let me give you some examples as to where the city and how it thinks about itself actually decides the health of the city. A healthy city, for example, is one in which citizens receive adequate light and ventilation. It seems like a small thing, but 100 years of evidence shows actually something quite different. In Bombay, when slum redevelopment began, an older rule, which is called the 63.5 degree light rule, which ensured that buildings were sufficiently spaced from each other, was diluted because people didn't fully understand what was the basis of this rule. It seemed like a waste of space was being created. This rule was implemented by the British in 1896 after the bubonic plague. What you found is that tuberculosis, because we think tuberculosis needs to be cured by better treatment. The reality is 40% of Indians have latent tuberculosis, and our biggest vehicle for preventing tuberculosis is to ensure that latent doesn't become active. Unfortunately, what happened, and there's a very beautiful project that was done by architects and pulmonologists coming together in Bombay, TB rates jumped in these slum rehabilitation households. In fact, in Bombay, if you are at all in Bombay, I would invite you to visit the Bombay Development Department Chawls. They are in the middle of the city in Prabhadevi. They are being redeveloped. I hope they will be redeveloped better. They have many problems. I'm not suggesting to you they are some paradise, but they are built in 1926 with 63.5 degree light rule implemented. They have many problems, but no tuberculosis, because there's enough light and ventilation between them. Whereas our modern buildings, built in 2007, really have an enormous problem. Detailed studies show that layouts that minimize airflow, narrow courtyards, inward-facing blocks, two-leaf windows, all of this are microclimates for tuberculosis and lower respiratory tract infections. And simply changing the building code, ensuring that no building gets approved without this kind of design input, could over time transform how the city works. There was already a discussion about walkability and the need for exercise. One of the issues that, certainly as somebody that has been working on health for a while, our idea that education is the gap is an incorrect idea. In fact, there is a very nice paper that shows you that amongst doctors, Kerala doctors are the most obese. It's not as if they don't know. It's not as if they don't. I teach a course in the Indian School of Business in public health, in health systems design. Every one of my students who's 35, 40, 45 has a waist more than 34 inches. It's not as if they don't have the education. The reality is, and there's a deeper evolutionary issue as to why we behave the way we behave. The way people have thought about cities and health is not to say you must exercise, I will exhort you to do this, and I will do advertising, but to design the city itself so that you have no choice but to walk. If you go to New York today, you have no choice, you must walk. If you go to Paris today, eat that heavy butter croissant, you have to walk. And that is what produces good health, not more education and more guidance. In fact, the whole idea of the city, and there's another subtle commentary you got a sense of in the discussion, cities need roads for transportation and walking needs to be added on. This is the fundamental vision of the city question. Is that the vision of the city that you have? Or is your vision of the city actually designed around walkability with when you say, where do the cars fit in, is something we have to think about, right? If you reverse it, you produce an unhealthy city. And I will try to suggest to you, you produce a city that is not good for growth, that is not good for prosperity, because somehow there is the sense that growth versus health. Actually, it turns out what my research shows, if you look long enough, both actually have to go together. And then, of course, there are a number of issues that I don't have time to get into just now, but there is climate-related issues, what is happening in informal settlements, noise. There is good research that shows, in New York, if you go to New York, you'll see I-95 goes through New York. Right? There are these apartments called bridge apartments built over I-95. Research shows that children who live closer to the highway in the bridge apartment versus closer that children let higher up, the higher up children have better IQ than the children that are at the lower down level, because the noise, the continuous buzz that they hear of the traffic, vowel sounds, they are not able to learn. And that's an important component of intelligence that actually gets deteriorated because the noise is far too much. And then, of course, the whole issue of mental health, right? The urban form impacts loneliness, anxiety, concentration, social cohesion. I already spoke about, noise pollution. Again, when we think about green spaces, we think about parks. The evidence is actually green streets, the trees along pavements, trees along streets actually are more important than isolated parks and lakes. That is where much of the green cover actually comes from. And children, you might say, well, they need places to play. Well, it turns out that if you have a park where child has to go, an adult needs to accompany the child. Often the adult is not available, so the child can't benefit from that park. Building safe sidewalks, building safe neighborhood locations where children can play right in front of their mother's eyes actually turns out to be a much better mechanism. So what makes a city healthy? It's not any one thing. It's not just hospitals, parks, or transit. You have to bring many things together. And I think this is where some of Shrikant's push of thinking about health and the city coming together, it's not simply a technical issue around, do I have enough doctors? Do I build the right hospitals or not? My sense is that can even be contracted out. It's more a matter of how do you think about all of these ideas coming together. Just to give you an example, in Glasgow, for example, it's a city that some of us might have visited. UK mid-century choices to relocate low families to peripheries with poor connectivity produced all kinds of health deficits, including crime, including pollution, all of that started to impact the rich. And as COVID told us, these kind of strategies don't produce good outcomes for the city. In Cameroon, much poorer country, Douala, it's, again, the same situation. They push the poor to the periphery to where the mangroves were, and all the pollution, all of the garbage dumps is where the poor were living. Other cities like Medellin, Colombia, murder capital of the world because of drug trade, because of many things. The city decided with its public transportation strategy to start to include the poor much better than the rich. And it found that crime rates fell. The rich started to set up businesses more in the city because the city became safer as a place to be. And it turns out growth and well-being of the city went hand in hand to build a strong city. Bangalore, as has been pointed out, is one of India's greatest success stories. Its economy, talent pool, culture of innovation are unmatched. But it's obvious, I am a new resident. I've been here only about 5 years. Severe ecological, climatic, and infrastructural stress. Tree cover has fallen. Lakes, have been encroached upon. Traffic congestion has begun to erode productivity. But we have responded to that by building more flyovers and I'm told there is a tunnel being planned, rather than rethinking, is that the design of the city that we really want? Vast new settlements in the periphery lack ventilation standards, walkability. It is true, in the heart of Bangalore, it might be hard to engineer it. Why is the same problem being replicated in the newer parts of the city? And then the other problem is that the city is choosing, and that's a deeper conversation to have, to build sprawl than to go up. And as a result, the compact form that is actually a characteristic of healthy cities. Santiago, for example, in Chile. Why is it a healthy city? Because it has not spread out. It has gone up, and it has made sure that there is adequate density to build businesses, local areas. So what we thought about, for example, is encroachment of businesses on sidewalks. If designed properly, you actually start to see much better local communities start to emerge and to figure out what to do. All of these stresses that the city is going through are not random. And in fact, one of these themes of my research is going to be that the core political vision of the city, when a policymaker goes to sleep at night and dreams about the future, what is in that dream? Is it these high-speed cars and big roads? These are kind of visions of the 60s. There used to be a show that we would all watch called Dallas, right? That's the vision. And my sense is a lot of the vision of our cities is informed by that. My request to policymakers is to visit Geneva, visit Copenhagen, cities that are large, Tokyo, for example, large cities that are much healthier and much faster growing than Dallas is able to. So I'll stop here. Obviously, we'll have other opportunity to talk a little bit more. Thank you.
Thank you so much, Nachiket. Srilata has been extremely indulgent and patient, but one key takeaway from the conversation so far, it's fascinating, it's something that Ajay told me pre-COVID when we got introduced, that he said two things. One is he said the urban poor are worse off in terms of health compared to the rural poor. And he said the reason for that is most of the causality of urban health lies outside of the domain of medical services. It lies in the domain of urban planning, urban infrastructure, and governance, which is what Nachiket so evocatively elaborated. But over to your opening comments on everything you've heard so far, Srilata.
Thank you. Thank you for the opportunity, and thank you, Nachiket, for sort of setting the, stage for something that I wanted to say, which is that the city produces the health of that city. I mean, the context of that city. And today, I think so far we've talked largely about two things. One is about growth, and the other is about governance. And both of them are critical. And in terms of, talking about growth and the value of growth and how growth has been important to Bangalore, unlike Nachiket, who said he's been here for 5 years, I've been here for 5 generations. So I've seen, the city change tremendously over definitely the past 3 decades. And certainly it's brought a whole set of new opportunities, etc. But it's also opened up a huge amount of precarity and vulnerability that perhaps were not so front and center, half a century ago. And along with that precarity comes some of the reputation of Bangalore for, its potholes and congestion and traffic and garbage, etc. But what we need to do is to connect all those contextual factors to public health. They're all essential to public health. The traffic and the congestion, we can't separate that from the rising incidence of pulmonary disease and cardiac risk in the city. The garbage collection, we can't separate that from the proliferation of vector-borne diseases in the city. All of these are part of the same, they all stem from the same sort of lack of planning and lack of a systematic way in which the city has been growing and developing over time. So in a way, Bangalore has been growing exponentially, but the imagination of the planners seems to be still sort of based in that, retirees paradise that it used to be, still thinking small when it really needs to start thinking big in terms of public transportation, in terms of civic amenities. Where's the water supply? Where's the sanitation? Where are the systems, for people to move around in a more in a more functional way. All of these things need to be thought through. The other thing I think that we need to think about very seriously is the issue of health equity in the context of the growth and the migration of a whole lot of different sets of people into the city. It's not just techies who are coming here. It's also people who come as construction labor, other kinds of labor, gig workers. How are these people going to have a social safety net and certainly a health safety net when the health infrastructure in the city is crumbling? Hospitals are understaffed, they're under-resourced. People really can't count on getting the healthcare that they need through the public health system. And so they resort to private care, which of course in Bangalore is abundant and it's available in all kinds of different shapes and forms, starting from the pharmacy at the street corner to, one room nursing home to an Apollo or a Fortis. And all of these are unaffordable even for the middle classes, let alone people who are living on the margins. So how does that, how can we start addressing those kinds of challenges of people who cannot access the kind of care that they need, and the care that they need not because of lifestyle choices? And here I have some, views on that. It's about also things that they end up being victims of the way that the city has developed over a period of time, and the economic opportunities, the only economic opportunities that are available to them. And then, of course, if we layer on top of all of that the issue of climate change and what it's doing, in terms of increasing episodes of heat, unseasonable rain, and so on and so forth. How do people deal with that? Are there interventions that we can really think about? And I think there are a few glimmers of hope. I think the Namma clinics, for example, are a really good initiative that has been started. Again, lots of problems, under-resourced, needs a lot more support. But there may be a way in which communities can start taking charge of their own health needs and health resources. That's one possibility. We have an active civil society in Bangalore, which is really nice. And they've made nice interventions over a period of time in terms of, for example, rejuvenating the lakes or, coming up with a climate action plan and so on and so forth. So it is possible to mobilize people, because there are people who are very exercised about the way public health has been going in Bangalore over a period of time. Can we, leverage that more effectively over a period of time? So I think my answer to your initial question is, I wish it could have been yes, but it can't. But it's not entirely a no either. I think we need to learn how to walk that tightrope and to be able to, maintain that balance and not fall off one way or another.
Thanks, Srilata. The interesting thing is the last conversation, the inaugural edition, was on the Greater Bangalore Governance Act. And we had Rizwan Arshad and Tejasvi Surya on opposite sides of the aisle. And now in this Bangalore debates, we have an interesting scenario where the political leaders from both sides of the aisle are on the same side of the response, and we have civil society on another side. I guess that's the richness of these open conversations. I have 2-3 short questions for you, Dr. Ashwath, after which I want to open it up for a round of questions and then pick up the conversation again here. So I want to pick up from what Professor Srilata said about the need to think big. And she said that in a particular context. She said Bangalore is no longer a pensioner's paradise, and that started happening perhaps in the 90s itself. But we somehow lagged behind. So if you were to step back and think through why is it and due to what factors didn't the political and administrative leadership in Bangalore catch up with that growth?
To be very frank, I think health was not given the priority. Many other issues, as Dr. Srilata has put across and Dr. Nachiket, in whatever form, whatever way, ultimately it comes to the health only, from the safe roads to public space to entire thing. Ultimately, it is the quality of life of a person. So probably in this direction, we need to give a lot of importance. One is in the preventive aspects, in the terms of planning, in the entire planning, the public transportation, the public health, all aspects from public space to every possible elements contribute for the quality of life and for a good health. The other aspect is directly coming to the point where, okay, once if they're affected with uh, communicable or non-communicable disease, how best we can provide them the good health care, where they can look up health equity. Health equity or any other equity, probably in these terms, we were able to during COVID. Before COVID, it was a, to be very frank, it was much more worse condition. Probably COVID has really opened our eyes, made us open our eyes and address the health in a much more bigger way. Probably because of all this thing, 15th Finance Commission, we were able to start 150, more than 150 NAMA clinics, and we were supposed to open more than 200, but because of lack of space or the not been prioritized, we were able to open 150, and that 150 also in a not in a right place. Probably uh, giving them lot of trust. The trust deficit only is there more. People, even poor people, they're not keen to come to government clinics. They don't look up to the government clinics. They don't have that kind of confidence or the trust. Will I get a good care or not? Itself is one credibility question is there. We keep seeing many a times to build that credibility or the trust itself is a big challenge in the public health system. Even if you go to the big hospital, many of these hospitals they are vacant. The beds,
Government hospitals.
yeah, the most of the hospitals, except one or few hospitals, there's a lot of rush. Super specialty hospitals, we have got more demand. So when it comes to the specialty hospital or general hospitals, we have a lot of vacant beds. So building the trust is very important. Probably a lot of, basically we need to, easiest thing what we can do is lifestyle management and planning. Planning plays a very important role, as Dr. Nachiket mentioned. Building code and light and ventilation is the most important. See, ultimately, good health is provided by a right kind of ventilation, and good air plays a very important role, and quality of the air plays a very important role. And public space and mental health, connecting with the community. Many times, most of us live in isolation. We don't know each other. We don't come into any community spaces, talk to each other, reach out to. There's a big communication gap, and the way city is more successful, only success is seen by one section of society, and that success is keep them away most of the time from the public life or the public connect. So the public is developing the public space, bringing people together, addressing the concern together. We can do a lot of things, and basically, even though we know a lot of good things, walking is good. Why walking is good? We should know how it will help us, how the walking will help our health to be good, and what kind of food we are supposed to eat. And most of our food is polluted. The pollution level or the kind of the food what we get is not good for our health. Most of our diseases is because of the food what we take, or the contaminated, or the whatever the water is being used to grow this fruits and vegetable, or the pesticides. It's causing most of the disease is because of the pesticides or the feeds what we use to grow the.
Right.
So along with this, and with regard to the walkable footpaths, we need to prioritize the walkable footpaths, and most of the time it is being occupied, and we need to deal very strongly. And at the same time, we give vendor rights, sidewalks. Yes, we want to have a lot of trees on the footpath. Most of the time, the size of the footpath doesn't permit you to have to grow trees. See, unless you have a very wide footpaths where the trees can be planted. If the footpaths is very narrow footpaths, if you grow trees, it is occupying the entire footpaths. You don't have place to walk. So like this, there are many issues. We need to repeatedly have this kind of discussion, create a lot of awareness, We need to tell them what is right. And many a times in a city, we don't believe in vertical growth. Always we believe in horizontal growth. We feel, high density is not good for a city, but we need to tell people very strongly, high density also is good for if any society to be, effectively we can cater public transportation system, all the minimum facilities, schooling, education or the healthcare, all the government facilities to be effectively provided, and even the law and order to be good, and public safety. We need to have a compact city and high density. Then only we can have a viable public transportation. Even the public transportation, you need to spread on 1,000 kilometers, 2,000. The cost is very prohibitive, and the usage also will be limited in this direction. And more so in schools. Schools and colleges are the right place to sensitize about the lifestyle. What is health? Because it's not just only doctors. Many a time we, as a doctors, also we learn a lot, but we don't know how to take care of ourselves. Also, we know so much, but we have got so much of knowledge with regard to the artificial intelligence, many other areas. But basic thing, we don't know how to take care of ourselves. A right good sleep, a good exercise, a right food. So basically, we need to understand how to take care of ourselves. If this is given importance in the school education is the right place for us to emphasize and make each and every person how to take care of ourselves. So
Sure.
these things can really strengthen and make the city more progressive and better place to live.
Thanks. You covered a very broad sweep of issues there. I have two follow-up questions. If you can give very short responses, I'll then open it up. One is, I want to pick up from the point that you made on public trust. And some of Nachiket's emerging research and what we've also seen globally appears to indicate that local governments play a key role in convergence and building the trust with the community. But both Mr. Gundurao and you, and I've seen this among several MLAs in the city, perhaps because of the erstwhile BBMP's track record, have a certain skepticism of the ability of local governments to deliver this. And you said in your earlier intervention itself that they're struggling to even do what we see is basic, like perhaps a road, footpath, picking up the garbage, etc. But if you can, so is it that, are you appearing to suggest, based on your experience, Dr. Ashwath Narayan, that India may need a different model where our local governments may need more time before they take up issues like public health? That's one question. The second one is, I also remember from some of our past conversations, and I just want to bring it up here in a particular context. As a public representative, I'm sure there are many people, particularly in the urban poor, who may be coming to you on public health related aspects, and where you may be relying on the administrative mechanism comprising bureaucrats to get some of these things done. So is there also a dynamic of a political leader and a bureaucrat playing out on this? Because I remember you had some interesting takes on that about a decade ago. I don't know whether your views have changed since then, on the ability of a public representative to hold a bureaucrat accountable for outcomes like public health. So if you can give brief responses to these two, we can then open it up a bit.
If you look at the city concepts in developed countries, it had started many hundreds of years before, many centuries before. The city concept, probably we are trying to catch up very recently, and to evolve and to address the strengthen the local governance as a city governance, I think we are still not matured enough, good enough. That is not an excuse for us to keep away from the decentralization and strengthening the local governance. Probably accountability and transparency is not been effectively dealt. It has been compromised. The biggest problem, always we tend to say we have failed as a city governance because there has not been much of accountability and transparency, and effectively decentralization has not. But centralization cannot help. Centralization of any governance, for that matter, any vertical decentralization should happen, and it should be in public domain, and transparency should be there, accountability should be there. But always we have been trying to give excuse, and that commitment is not there. Most of the time we should be very clear about it. Even though we might fail, doesn't matter, we need to take 10 steps forward. it ultimately should be on the other side of that city to take that ownership. That city to take the ownership, and if good or bad, it is your take. You should all involve, participate, and address whatever challenges comes up in that city, and you should all involve. So we need to strongly take it up very seriously. And now today's technology, I think if effectively, if technology is implemented, adapted properly, probably it becomes very simple, which I have done in my own departments, and we were able to get results. Similarly, we can do it here also. I think we need to take it up. And with regard to the second question,
The relationship between the public representative and the bureaucrat, is that one of the determinants or no?
yes, what happens when we are in government? I think we can decide most of the things. When you are in MLA, we'll be on the more on a receiving side. So I have seen this difference. When I was in a part of the government, we can decide many things. We can command and enforce. And it's not that, we should not let even the only bureaucrats to take over because of our weakness and our clarity and our understanding and our preparedness. We should have very clear-cut roadmap. See, once we are going to, for example, 28, we are going to come to the power. We should be prepared what we are going to do when we come back to the power with regard to the, no, just for example, I'm telling you.
Right.
After coming to the power, we have meetings with our officers. It is not that. As a political party, we need to be very clear what we are going to do, where we are, where we need to go, what are the challenges. Benchmarking has to be done. The preparation has to be in micro level. We should have clarity. We should just tell them, implement, work, and report. Your job is to only implement and work, nothing else. We should not ask, sit along with them, ask, take their advice. I don't believe in this. I don't their advice. We want them to just work. What is our goal and vision and mission should be taken care. So with this clarity, probably we'll prepare, we'll take all of your assistance. We want it to be, people's government. A people's government, people's involvement. Let it be any political. I am not trying to, more than any party or anything, we want ultimately service to be delivered to the people. It should be people's government, doesn't matter. So probably seriously, why we are come here, the purpose has to be very clear. Probably in this understanding, all of you have been working very dedicatedly. We should make best use of it, and we should be open. Let us be open. Any reforms we want to bring also, let us discuss. Even before coming to the power, even with Dinesh, frankly, to be why we are on the same. Earlier, we had a very serious argument. We were trying to take the government head on, and we were trying to expose the entire government. But seeing that it doesn't help anybody. No, criticizing them, exposing is one part, but we need to also talk to them. We told whatever reform you want to bring, please do bring it. We are here to help you support. We had myself and my leader of the opposition, Ashok, we sat across with Dinesh. We told him, come out with whatever reforms you want. Be open. Ultimately, we need to do good for the people. Just it's not, blaming each other doesn't mean anything. So we
Sure.
were very keen to see good things happening for our people.
Thanks.
People, because they trust us. Again, it should not become the same trust deficit.
Thank you. Thank you, Dr. Ashwath. One of the purposes here is also to bring policymakers, particularly elected representatives and civil society, face to face for these conversations. I want to get a couple of more perspectives. So one is, Nachiket, two things from you. We'll come back to the audience. The one is, there was an emphasis both by Mr. Gundarao and by Dr. Ashwath, and you mentioned as well in your speech, about the false dichotomy between growth and health. If you can unpack that a little bit. Because the orientation of the government, we know, is to get more and more investments in and get more built up space, commercial space getting built, etc. The second question is, if you can elaborate on what you spoke in your opening address on the relevance of the research you've done, particularly in South America and so on, to the Indian context. And there was also something about the irreversibility of some decisions, policy choices, and therefore the significance of getting it right. That seemed quite scary. The fact that you get locked into some poor outcome trajectory. If you can elaborate on these two.
quickly, one issue is of the link between growth and health. And I often hear this in my discussions that health is not important. I used to be earlier in finance. I was in the board of Reserve Bank of India. It was much easier to convince people finance mattered for growth. Much harder to convince people that health matters for growth. In our minds, the thinking is still based around 20 industrialists, 40 tech parks, 6 IT people. They will produce the growth. And therefore, the entire machinery is directed towards helping them. The reality of India is if we're growing at 6-7%, China grew at 12% per annum over a 30-year period. You don't get this kind of growth by focusing on a narrow segment of the population. You need to harness the power of the entire citizenry. Now ask the question, are these highways, these super facilities that we are building, the sprawl that we are getting, are they including the people that need to be included to drive the growth engine of the economy? I would argue to you, no. In fact, there was a very nice report done some years ago on looking at financial exclusion in the heart of Bangalore. It is worse than Bihar. Because the reality is that the banks and institutions have been designed for rich people, for industrialists, and think of now that back into health. One of the questions that came up is congestion is a problem. Is it a problem though? London is putting a congestion tax to artificially create congestion so that people don't come into the city with cars. Bangalore has a natural advantage of lots of congestion. Are we not able to redesign the city so that growth happens where the people live rather than spending 2 hours each day going back and forth to some other part of and making that easier and easier and easier, right? This and the link back to health then becomes quite obvious, right? You cut excessive transportation by car. You ensure that people walk to work, do their shopping locally, think about what is happening to them in the neighborhoods. That produces much better health outcomes. And of course, the other issue is that, and this often comes up more in the rural context than in the urban context, right? People say, well, why are we focused on maternal child health, for example, right? Where is their contribution? It's seen more as a welfare measure. But ask any household, particularly in the Indian rural context, urban is a little bit different. If the woman of the household falls sick, the entire household collapses, right? In fact, there's a very nice paper out of Africa that shows that you can explain GDP growth differentials by maternal mortality rate. Because, the anchor of the household, and now look at mental health, look at many of these other aspects. You have a schizophrenic child at home, the whole household is 50% less productive than they would be if they had somebody to either look after or the child was actually not so sick. So again, there is a link back with growth that is not always seen as happening. About the irreversibility. See, the issue in urban growth, and in fact, until you asked me to speak a little bit about Bangalore, my own view a little bit privately has been that for the large cities, it's too late. In fact, we need to benefit from the natural decay of these cities for the benefit of the rest of the state, for the benefit of the rest of the... I used to be in the board of a large company. The only reason why we shifted some of our new work to cities like Jaipur was because Bangalore just couldn't give us the opportunity to grow properly. Right? And in a way, that was good for Jaipur. It can be good for North Karnataka. If, for example, South Karnataka becomes a little bit harder. Why do I have this view? I feel that despite all our best efforts, Bangalore has made many irreversible choices. Once you start planning your roads, once you start planning how you are thinking about the city, landowners come in, property owners come in, property prices start. In Bombay, I used to live in Bombay for many years. Look at Nariman Point. Right? It's become an island of dysfunctional prosperity. There's nothing one can do about it now. Right? City is exacerbating it by making it faster to get there, to build tunnels, to build coastal roads, etc., because they're dreaming of Dallas. Right? And this is not, but I could argue to you, too many people and lobbies now are interested in that. And, politics, business, lobbying, money, it becomes irreversible. It's early when there is no money, when it's a patch of land, and the city is still starting to think of. And the good thing about India is that we have hundreds, if not thousands, of new cities we have to build. Karnataka itself, there is a lot of new city development to happen. Right? What can we do about those cities? That reflects our understanding of what new cities will be. Then gradually people will start coming to Bangalore in the same way that they are. They start to live there, build those cities up. This is what happened in the US. This is what happened in a lot of European countries. Cities stopped growing because the hinterland started growing.
Thanks, Nachiket. One quick comment from Srilata on if you can. When we spoke initially, you spoke. In my naivete, I told you women, children, etc. in the same sentence, and you said no, you got to break them up separately. They're all not the same. So if you can tell us a little bit more about how the city needs to look at equity, because one of the dangers I think that Bangalore has is that the poor and the migrants are not as visible. It in some ways it's become a middle class city in terms of public discourse, in terms of some of the bureaucrats and elected representatives complain, and I think it's not without due cause, that because Bangalore is hyperactive in certain geographical areas on, say, Twitter, the challenge of congestion or flooding in certain areas may be getting accentuated. In the same way, the voice of the urban poor and migrant, and it also speaks to what he said about financial exclusion in the heart of Bangalore and so on. So if you can speak to a little bit of equity in Bangalore and the way you see it. We'll again open it up after that.
I'd like to talk about equity in a couple of different ways, because one is, of course, we think of the migrants, the construction workers, the laborers, the gig workers, etc. And you realize that they are living in tremendous precarity. They're physically putting themselves at risk. They certainly have challenges in terms of their mental health issues because of the fact that they are excluded from the city's imagination and from the city's social and cultural life. They also have issues of alienation, loneliness, being away from their families and from their communities and so on. So how is the health system or the public health infrastructure in the city actually supporting them? And you would have to say that it's doing a very poor job, because if you just look at civic amenities which are critical to their health, even physical health, let's say, forget about other larger issues of mental health. Clean water. Where is the assurance that they're going to have clean water to drink? You look at what is happening in Lingarajapuram as we speak, and people are getting sewage water delivered in their pipes. That's one example. It's happening all the time, everywhere in the city, every day. The other thing is, of course, pollution. And we're not talking, noise pollution is very critical, obviously, in the kinds of places that people, these kinds of marginalized communities are living. But, and overcrowding, which has its own problems, but air pollution, which affects not just the poorest and the most vulnerable, but every single one of us. But some of us are even more vulnerable than others because we already have pre-existing conditions and risks that make us more vulnerable to these kinds of, physical assaults that we face. The other thing, of course, is the availability of health services. Unless the public health network is strengthened considerably, people, there is plenty of evidence, and I'm sure Nachiket knows the numbers, of people falling into further poverty because of health issues, right? Everywhere, and definitely in Bangalore. Bangalore is certainly probably a textbook case of where people end up having to spend money that they absolutely don't have and cannot afford in order to get basic health care. And the trust issue is very important, because even in places where public health facilities work, people don't trust them enough to be able to go there, to want to go there, even to get a vaccination. I've heard people, women who work in the house, who will take their children to get vaccinated at a private clinic, paying 1,500 rupees, rather than go to the government PHC and get vaccination, a basic thing, That's the level of mistrust that has now over time evolved. But there's another group that I'd really like to talk about, and that is the people who bear the disproportionate burden of care work in the city. And given that there are so many different sources of risks and vulnerability to exposure and to disease, morbidity, the people who bear the burden of care are women. And the women who care for children, for the elderly, for the sick, for people with chronic conditions, for people who, for family members who are down with a fever or flu or diarrhea, or whatever it is, the unpaid care work that women do, I think, goes largely unrecognized and unacknowledged.
What can the city do for that? What would you recommend as a policy measure on that front?
Well, actually, the Griha Lakshmi program has, I think it's been interesting that it has actually recognized, it may be just 2,000 rupees, people may say it's a token amount, but it's an acknowledgement that women are bearing the disproportionate burden of care work. But other things that the city can do, for example, the companies, we have so many, hundreds of tech, biotech, and other kinds of companies. Can they have more flexible working hours for women, for example? Can they provide leave for men as well to bear part of the burden of the care work, to support the family in terms of providing care? These are small things that can be part of even the formal sector. The informal sector, the government has to provide safety nets. Griha Lakshmi is good. The Shakti program is good, where women at least don't have to spend money on transport, and they can use that for to support the care work that they do. But there are ways in which it can be done. I think they need to be coordinated better, and they need to be more consistently resourced, and they should be justiciable. They should be entitlements, not schemes. They should be justiciable rights.
Thank you. Thank you, Srilata. We'll again come back to the audience and
Sure.
state your name.
I'm a long-term resident of Bangalore from childhood. I've been facing problem with the pigeons. They were causing me disease, and I did not know about it from 2021, 22. I suffered.
Yeah.
I could not get anybody to do anything about it. BBMP, Health Department, RT, everything. Nobody did. And now there is a conflict happening
Question.
between.
Please come to the question.
So how do you acknowledge? Health Department acknowledge, how do you stop the pigeon infections spreading in residential areas?
Yeah, my question is to you, sir. Both your colleagues, the party colleagues, Tejasvi Surya and Dr. P.C. Mohan, have opposed the idea of this tunnel road maze. And after hearing Dr. Nachiket, would you also like to join them to oppose those tunnel road
Very good question.
projects,
Okay.
sir?
Good.
One
Okay.
more matter.
Okay.
You
We
know,
can't not have a debate without tunnel road coming in.
Yes, that's right. No, about Dr.
Professor Srilata Rao
Srilata Rao has talked about more women being on the move these days. And in that respect, about a few weeks back, there was a report in Deccan Herald about the state of the public toilets. It's dismal. And because of this, many of these women are contracting UTI and these kinds of problems. Now, I went over and talked to Anand Sweets owner in Kormangala, and very close to that, there is a public toilet. And I asked him, would you like to take over that thing?
Right.
He said, definitely, if I am facilitated by
Understood.
the department.
Okay. So the question
So
is,
I
can
would
we have
think-
PPPs?
I
or
would think that is the way
partnerships?
to do it.
Sure.
Because I don't think the government is in a position to
Thanks.
manage.
Great
our-
questions,
Thank
Mr.
you.
Rao. Thank you so much. Please keep it short.
Hello, I'm Virag from Azim Premji University. Just a short question. As we know that Bangalore contributes to around 40% of Karnataka's GDP. Just a clarification, I wanted to know what sorts of measures are being taken by legislators in Karnataka to address this economic strain on Bangalore. What are the measures which are being taken to boost the growth of other economic centers within
Okay.
Karnataka?
We'll see whether Dr. Ashwath may have some perspectives on that.
Hi, my name is Ayman. I've been in Bangalore for some 13 years right now. I just want to know what's being done to address the hard water problem which we have in Bangalore. So
Hard
if you
water.
stay, yeah, if you stay in any apartment, the quality of water you get is abyssal. So if there's anything which has been done for that, or what can we do? Yeah, just
Okay.
that.
Okay.
Good afternoon, everyone. I'm Maitri and I'm a student of psychology. So, as a psychology student who is studying the intersection of urban planning and public mental health, how does the city integrate preventive approaches like design, infrastructure, and policy, and curative approaches like services, care access, community interventions to promote mental well being?
It doesn't. Short answer. Sorry, but it's a great question, but the fact is it doesn't. But I would request Professor Seshadri to elaborate on that. Gentleman in the black.
My name is Santosh. I'm a Bangalorean. I wanted to ask Dr. Nachiket more specifically, looking at water supply. You know, there's a point where as children, we used to drink water from the taps. On the railway station, we used to run across and collect water. Now, with all these lobbies and all having come in and cities having grown like this, have we reached a point where people have lost faith in the ability of the government to provide proper drinking water and everybody reverts to bottled water, which also creates a lot of waste and things like that?
Sure. Thank you.
Pigeons, clearly there is a big respiratory issue that is associated with pigeon poo, which is exceptionally true of pigeons. In Bombay, there's a big fight going on right now, legal, etc. The Jain community, you know, and many of these issues have to be resolved. Dogs is another issue that is causing this. There's a broader One Health perspective that we need to look at. One of the issues that I'm very concerned about are bat populations. You know, whenever you see small bat populations in cities, it generally means there is a high stress population. It's shedding viruses quite aggressively because bats, now all bats are different. Many bats though live in large communities in the forests away from cities. If they show up in large numbers in cities, it means something has happened to your forests that are preventing this from happening. So, you know, it's one of those questions that one has to look at in a somewhat broader way, not necessarily just focusing on pigeons, but overall, what are we doing with other sources of disease that are coming up? My own anxiety is, and I have a paper on this, the rapidity of zoonotic transmission and spillovers is going up in the country and particularly in cities where you see this mixing of so-called wildlife and human beings.
With regard to the tunnel road, sir, as a party, we are not against the tunnel road, to be very frank with you. But it's not viability. Technical aspect is been questioned. The technical aspect is been questioned. So when it comes to the development, we don't want to be on the other side. So basically, the entire design, planning is not been done, and the environment viability or the feasibility is not looked into it. Many other options have not been worked out properly. So we need to make it very clear before they get into the tunnel project, going 150 feet, not it is getting 150 feet down itself is a tough job. So basically taking the public space like Lal Bagh, Sankey-Tang. So these are the very questionable aspects, and we want to clear the technical aspects. If you tell openly blanket statement of only opposing, then they think opposition is just being in opposition, we just oppose. So we want to be, and with regard to the public toilets, sir, definitely yes, participation, each one of us need to participate and ensure, because passing of
He's talking about PPPs. Can
yeah,
we have
PPP, definitely
neighborhood?
PPP, and even the public or even the government can take responsibility, or the PPP model. Anything is fine, sir. Ultimately, we want very hygiene toilets. It's welcome. And with regard to the hard water, install softener. That's all.
Okay, so which means some of these, I mean, we have many issues. We have a complexity. There's a major fragmentation issue. The rest of the world, we have to acknowledge, works with strong local governments, which is the point of convergence where most of these issues, even if they don't get addressed, are held accountable. And we are unfortunately in a system where there is no governance of the place. You govern the city as an aggregation of sectors, and that automatically fragments service delivery and accountability. And which is why the emphasis on decentralization and empowered local governments becomes significant. So, I mean, some of these are not laughing matters. Unfortunately, we've not made much progress on them. We've just identified the issue. And really building the capabilities of the local government rather than looking at it as the outsourced service provider arm of the state government. That needs to change, but we are some time away from it. We are at 12:27. We like to keep it at time. So I'm going to ask each of our panelists to close with what do you think should be the immediate next step for Bangalore to take to deliver healthy life. And Nachiket, we are not going to accept that it's too late. We as Bangaloreans cannot play the odds on this one. So I guess hard as it might be, I think some of us will still have to fight that fight. So one step that you would recommend the state government, the GBA and the municipal corporations together start taking to set us on the trajectory of delivering a good healthy life to Bangaloreans?
Okay, I'm going to start by saying something that I've been saying for a while now, which is I think the government needs to bring the public back into public health. I think at some point, the government does what it thinks best and does it as best as it can, perhaps with whatever resources it's able to, eke out of every other sort of resource bucket that it has. But I think having genuine conversations, not just at the BIC, but everywhere in communities about what are the public health needs of that community and what are the resources available. As we heard earlier, can they collaborate with private entities to help run some of those things? Can the communities themselves take charge of some things? Can the government take responsibility for providing certain kinds of services and make sure that they're done at a high quality and in a reliable, trustworthy manner? I think bringing the public back into public health is something that the government can do and it should do. It used to do it. It's been forgotten, I think, at some point, but it can do it again. Thank you.
I completely endorse Dr. Srilata's statement. And we need to create a lot of awareness. Awareness is everything, because lifestyle management and lifestyle diseases are the big challenge what we have been facing. We need to create a lot of awareness. Basically, we should know how to take care of ourselves. Probably in this direction, we need to work more and create more awareness in schools and colleges are the right places, and in community also. And along with this, we need to develop a lot of public spaces to engage them in sports activity and getting into the parks to walk, and as well as walkable footpaths to walk to the office. And we need not have a separate time for exercising. That's a privilege in a city to have a separate time to exercise. So wherever we do, whatever we do, we need to get exercise while going to the office itself or any other public spaces. So probably we need to work in this direction. And when it comes to the value, if you see comparatively in India, we feel Bangalore economy is a big economy. But if you compare with any other big cities, our economy is very small, sir. We need to ensure probably the quality of life, and as well as we need to develop other tier 2, tier 3 cities. Basically, the basic infrastructure itself is missing. Even the 24/7 power. In rural area, we need to provide now. At present, we have 5 hours, 3-phase power. We need to ensure 3-phase power should be there for 24 hours, high-speed internet. And the similar quality of infrastructure, let it be education, healthcare, or e-commerce or government services, everything should be available in the remote village. Then only we can prevent the migration. Mitigation of the migration can happen. Definitely, that should be our goal, and definitely we'll work in that direction and develop even the smallest village should be developed. We'll prioritize and work in that direction.
My own thought is that, there are, as was pointed out by many people, many tactical problems that need to be sorted out. My fear a little bit is what is happening is the time of the policymakers, bureaucrats is getting completely consumed by these tactical issues. If Bangalore is to become a city that has health, prosperity, and growth, all three happening, I think there has to be a bipartisan movement amongst politicians to set a vision for the city. For example, this critical question of does the city grow vertically? Does it grow horizontally? It's not an accidental question that will be resolved over time. It's an explicit political conversation that needs to be had about people. And I think that, with senior policymakers here as well as in the city, if we begin with that, the tactical issues, this issue of public-private partnership because government is not delivering, it's a problem across the board. The solution is not to respond tactically to the problem and say, let's build a PPP. Let's hand over the management of the toilet to the neighborhood business. But to go back and ask the question, are we doing government wrong? Are we working with government in a way that is preventing it? And, as I was sharing earlier with Dr., with some of the other people, my work is in understanding how to reform the public sector. And I find that this conversation about tactical accountability is actually getting in the way. We need a more trust-based approach, much more longer-term accountability, and then we will get the kind of results that we want.
Bring public back into public health, lifestyle awareness, active mobility, and political vision, and thinking long and big. Let me add my one bit to that before we close, which is that one running theme between the last edition of the Bangalore Debates and this edition of the Bangalore Debates is also the fact that the combination of responsive, accountable governance, which each of us yearns for as citizens, and the capability of the state to deliver high-quality infrastructure and services cannot be taken for granted in India's cities, including Bangalore. This is not a problem that's going to get solved overnight, including the case of public health. And this would require many of us to come together, not just to exact accountability from the state, which we certainly should do, but to engage constructively with each other and with policy makers, including to build the capability of the state. I work very closely with constitutional bodies, union and state governments, and I can tell you that the more you get into government, the more you wonder how our cities even run, including Bangalore. So there is one of our endeavors with the Bangalore Debates is also to stimulate local collective action. I want to thank Sandhya and team BIC for working closely with us and for being fairly patient and indulgent. All the support staff that have put all of this together behind the scenes. But most importantly, to thank each of you, citizens of Bangalore, who have chosen to think beyond yourself and your families and spend time on public causes. And this is ultimately what will deliver the future to us. Thank you so much.